A child life specialist is a healthcare professional that helps infants, children, and teens navigate the process of illness and make children feel comfortable within the hospital setting. We also support siblings and parents, caregivers. Our main goal is to make sure that the children are able to cope well throughout hospitalization and also through any tests or surgeries, whether that be bringing them activities, games, explaining different procedures. We're trained to explain procedures in a way that kids can understand, and then we also help them through that procedure. We use a lot of techniques such as distraction, deep breathing, and other coping mechanisms to help them throughout those procedures. I think the biggest tip is to be honest with your child. Kids know what's going on, and especially teens, and so if you're honest with them and explaining in a simple way what's going to be going on, then that will really help them understand why they're at the hospital. And also explaining to them that there's a doctor whose job is to make sure that they are asleep and stay asleep, and making sure that they know that they won't feel anything during their surgery. Another helpful tip is to play with the doctor's kit to help familiarize your child with the equipment that they might see while they're here for surgery. Bring your child's favorite comfort items, toys, blankets, anything that makes them feel comfortable, because they will be able to have that before and after their surgery. It's also helpful to find an age-appropriate book about going to the hospital and read that with your child at home before they go in for their surgery. Encouraging your child to ask questions will also give them a sense of control and make them feel more comfortable while they're at the hospital. The hospital is a scary place for kids, and so that's why the child life specialists at Overland Park Regional Medical Center really make an effort to make sure that children and families are comfortable while they're here at the hospital.